Hi, everyone. Can
Hello, Mayor.
everyone nod if you can hear me? All right, all right.
Yes, yes, I can hear you.
Excellent. Thanks, everyone, for joining. I'll dive in with some updates and then open it up for questions. Um, and if folks can put their phones on mute, or maybe Gage, you can do that as well for now. And then later on, after I open up to questions, we'll unmute people one at a time. So we have 12 verified positive cases of COVID-19. As is always, we believe there are many more cases in New Haven. There's still very limited testing going on, and there's also a delay in the time that people are tested and when we get those results back. One of the new cases is our first pediatric case. It's a 10-year-old child that's at the hospital as of this morning, but in stable condition. The other news that some people may have seen is there's a individual who is a homeless individual who has tested positive for COVID-19 and left the hospital this morning despite being under a public health order not to do so. The individual was under a public health order by Director Bond to quarantine him until the healthcare providers were able to release him. Police are looking for this man. The individual is described as a white man last seen wearing a black leather jacket, gray hooded sweatshirt, black jeans, and a black baseball hat, and carrying a black backpack. He was born in 1969. For his safety and the safety of residents in the city, we're asking for people to help if they do see this person by calling the police at 203-946-6316. 203-946-6316. Few other things, and then I can hand it over to Director Bond and then Chief Reyes if they want to add some additional details. We're still looking for N95 masks along with other PPE, personal protective equipment. We're putting out a call to residents in the region to, if they have N95 masks that have not been used in decent shape, to bring them by their local firehouse in New Haven. It's funny because I didn't really realize what N95 masks were until I Googled them and realized I have a few in my basement. And so I'll be contributing to that effort, and we're asking many others to do the same. N95 masks are pretty commonly used in everything from the nail salon industry to construction industry. So we're asking residents if they're able to ask their friends and reach out to their networks to help us find N95 masks so that we can keep our first responders safe. One thing to note, if people do bring masks to our local firehouses, they should obviously do so under the same guidelines that we've been giving out. People should go alone, practice social distancing. When they arrive at the firehouse, they should not closely approach any of the individuals there because we want to make sure that we keep everyone safe. And one other thing I wanted to note before I hand it over to the other two is that the hospital continues to provide care to the uninsured, the underinsured, and undocumented as before. So their free care policies are in full effect, and they'll not be billing uninsured patients. And uninsured and underinsured COVID-19 testing will not be billed as well. And I'm very grateful to the hospital for continuing that policy and making sure that we can provide resources to those that are most unable to pay. So why don't I hand it over to Director Bond and then Chief Reyes, and then we can open it up to questions.
Thank you, Mayor. So good afternoon. We at the Health Department, of course, are carrying out our mission of ensuring that we are protecting and preventing COVID-19 from spreading and trying to track the surveilling of this COVID-19 virus. A couple of things. As the Mayor indicated, we have 12 cases. The two new cases that arrived, the first one is an individual that was part of a detox program and a client of a service organization. We are doing contact tracing and are following that very closely to ensure the safety of others. And of course, we have our first pediatric case and as the mayor described. So it's really critical. So when we're talking about this not being an elderly only crisis, this is for all populations. As I indicated in previous press conferences, we have our youngest now being 10 to our oldest being 73. And so we have a broad spectrum of ages. And so I've been seeing a lot of things on social media about hashtag boomers and and also stigma around hashtag kung flu. So we want to be mindful as we continue to report that this is not about one specific race. This is not about a specific age group. This is affecting the entire population. And so we're asking you to continue to safeguard and adhere to the recommendations that are being rolled out and executed. We're also asking local food establishments to please follow proper food handling protocols. And so what we're asking is that you also follow proper social distancing, although you're doing takeout orders, that you're still handling the food precautions and disinfecting often, so cleaning all your surfaces. We're also asking you to continuously wash your hands, employees that are handling food. If employees are sick, we're asking food establishments to not allow their employees to come in to work. So please monitor your employees in regards to that. We are recommending that you do curbside pickup only. We're recommending that individuals do not allow the customers to come into the establishment, but rather have the establishment come out and do curbside takeout and pickup. And so, of course, as we always indicate, please call us if you have any questions or you think that there is a risk of exposure at 203-946-4949. Thank you.
Thanks, Director Bond. Chief Reyes, I'm going to unmute you now. Oh, it looks like you're already unmuted.
Good afternoon, everyone. So, as the mayor stated, we are looking for this individual and appreciate any help that the public can provide us. We only ask that if someone does think they see this individual, to please contact us so that we can approach the individual and see if we can bring him in. That's important. We continue to deal with the evolving threat of this virus, and what that means for public safety is that we want to work very closely with every one of our citizens to make sure that they're safe. One of the things that you'll be seeing, or that started yesterday afternoon, was that officers are going to be putting out a public service announcement over the loudspeaker. It is a familiar voice, is that of our mayor. And what we're doing is, again, trying to spread the message to make sure that people understand the gravity of this incident and the importance of us to work together to try to get through it as soon as possible. As you know, we have modified many of our services. We're still trying to do the best that we can to provide the necessary services, the critical services to our citizens, but obviously under the circumstances, our officers are responding in limited fashion only to the more critical incidents, and we've provided information on our website as to the other services that people may need and how to achieve getting those services. The officers are obviously in need of PPE equipment, as the mayor stated, and we appreciate all the assistance that we can get to help our officers stay as safe as possible. They themselves are trying to practice social distancing, so when they respond to calls, they're not going inside establishments. They're asking people to come out in those cases when we do respond to calls. And so we ask that you are patient with us and you help us achieve those goals. I will open it up to questions for now. I just want to send a message to everyone. There's been a lot of questions of whether or not law enforcement is still occurring. And make no mistake about it, we're still enforcing the law. And to any would-be criminal, we're not going to allow anyone to take advantage of these times. We want to keep our citizenry safe, and so we will continue to enforce the law. But for the minor crimes, we're obviously right now worried about getting through this, and so our enforcement will be relegated to really dealing with the more serious crimes. But we're asking everybody to be patient with us and help us get through this as well.
Thanks, Chief. So I'm going to try to manage the questions as best I can with people. I see some people on Zoom video, which I think will be easier, but there's some people on the phone. But does anybody have any questions? I figured. Why don't we start with Mary O'Leary?
Thanks. Can you explain a little bit? I mean, the man who left, I guess he left the hospital, the one who was, and what are the protections like for the hospital? Was he already in a hospital bed or was he in the emergency room that he just got up and left?
Director Bond, do you want to answer?
Sure. So good afternoon, Mary. So yes, so the individual was hospitalized and was being treated for COVID-19. We did issue a public health order to ensure that he would be quarantined and not discharged until he was cleared. Unfortunately, he left without medical advice, and so we want to bring him back to care as soon as possible.
Okay. I mean, again, was he basically just kind of checking in and tested correctly, or was he in a room and left?
He was an inpatient already there for a period of time and being treated.
Okay. All right. So go ahead.
Just Mary, one more point on that. So I've been in communications with the hospital, and we plan to have a conversation later today after they assess what happened to make sure that we can ensure this doesn't happen again.
Okay. Just wanted to check one other thing too. I think the individual who was in the group home that I think was hospitalized at one point, is that individual out? And did he actually have the virus? I thought I read something that wasn't the case.
So the previous interview that we discussed about that individual tested negative, and there's no link between the two that we're talking about now.
Right. Okay. So that person's out, and there's no problem.
Yeah.
Okay. I see that Mr. Bass had a question. I'm trying to unmute you, Paul, but it's not working.
How about now? Can you hear me?
There you go.
It's nice to see you all. I hope everyone's safe. I've been reading in other communities about how insular communities within cities haven't always reported when people have the virus. Have you encountered any problems of people not coming forward when they have contracted COVID-19? And have you taken any special efforts? And if you could be specific, I'd appreciate that.
Is that question directed to me, Paul?
Either of you. Like, why do people need to come forward, and have any communities been reluctant to come forward? Have you been dealing with any of that?
I mean, I can answer at a high level that the reason that people need to come forward is twofold. The first is that we need to make sure that we are helping them and keeping an eye on them, educating them on how they can take care of themselves. And the second is we need to make sure that they are helping us take care of the community by self-isolating and ensuring that we understand who they've interacted with so that we can reduce the likelihood that their family, their friends, their relatives, and other community members make sure that they don't get impacted. I think that it's been pretty clear that there's a lot of different people that since everyone has had to learn quite quickly about this virus, there's the potential for there to be misinformation and misunderstandings and concern about stigma associated with the virus. And so that's one of the reasons why we've had so many press conferences and done so much outreach to educate people on it. We have had some people reach out with some concerns about their own privacy. And we're taking that into account because we want to make sure that we're balancing protecting the community with protecting people's privacy. I don't know if Director Bond, you want to add something to that?
No, I think that's very accurate. And in addition, it's a reportable disease, and so it does get reported to us. And as we get results, we follow through and conduct contact tracing to ensure that we are providing the support that they need. providing recommendations, and also identifying any basic needs that they have, so that we can connect them with the proper resources. And so, yes, it is important for us, and we are trying our best to ensure that we are, connecting with our local partners to get access to the reportable positive cases.
And there's a history with these types of things happening where virus doesn't care what someone looks like, what their economic background is, etc. But there's a history of stigma being attached to groups that may first get the virus or may have, for whatever reason, be heavily impacted by it. And I think we've seen that with this virus in China, where even the president himself is trying to push a narrative that the virus China should be blamed for the virus. We had some initial concerns that Chinese people would be targeted based on some comments on Facebook and such. And so those concerns continued. We are still monitoring those types of concerns because we don't want any one community to be labeled inappropriately because there's individuals in that community that may contract the virus.
I guess, Justin, part of my question grew out of, and obviously I don't want to reveal identities. I've heard unconfirmed reports about people not reporting it because they're worried about their communities being targeted, and therefore people in New Haven being concerned about certain public places because they think there are people walking around with it who aren't reporting it, who aren't getting the help. But I don't know if that's true. And I just, that's secondhand. I just wondering if any of that's come by your way and if you specifically dealt with any of that.
So I think people that are going to public places should be concerned not because people are afraid to report it, but because we're not doing adequate testing, because it appears that the virus may spread even before people start to show severe symptoms. So I think that message needs to get out there loud and clear, that people should be concerned about interacting with other people no matter what.
Got it.
Correct.
Channel 8. Let me see if I can unmute you. All right.
Hey there, can you hear me?
Yep.
Awesome. Thank you so much for taking my question. I just, when I was calling in, I had some trouble unmuting, but I finally got the audio, and I just want to make sure I'm hearing correctly. I know the governor is sending out a kind of an automated message about staying home and staying safe. Have you discussed at all what measures or specific measures the city would be taking in light of that suggestion?
So I'm glad that the governor was it Friday, pushed out that order. I think it's a very strong step in the right direction of pushing people to stay at home and not interact with each other. That is added to some of our own orders my own orders in the city to reduce opportunities for people to gather together. Our police department is working to enforce these orders. And I'm happy if Chief Reyes, you want to chime in here and talk a little bit about the work that you're doing to enforce the orders.
Yeah, absolutely, Mayor. As we said previously, we are driving around, making sure that people are engaging in social distancing, that they're not congregating, that people are not in parks. We're driving around the establishments, the bars, and we're making sure that they're adhering to all the orders. Again, our efforts here are to do as much as we can early on to prevent this from being a prolonged effort. So, our goal is to enforce those orders and to do it in a way where people comply without the need for any arrest or enforcement.
Gotcha.
And we've generally found that people have been complying. And when generally people are complying before the police have to intervene, but when the police have had to intervene, people are agreeable, and stores have been agreeable to working with us.
Gotcha. And so as far as, is there any talks of a potential lockdown where residents wouldn't be able to leave their house, or is it kind of like a cross the bridge when we get there moment at this point?
I think at this point, it's a combination of the existing orders and us continuing to push this message. One of the purposes of having the police cars driving around town with a message is to make sure that we're using every available opportunity for us to remind people just how serious this situation is.
Gotcha. And so you mentioned, of course, the last resort always is to include the police to avoid any arrests, because at this point, the police is really focusing on kind of the major crimes at this point, but still thus far it hasn't gotten to the point where you've had to arrest anyone or a group of people for not complying. Is that what you're
No, obviously we do not want to arrest anyone or issue citations or anything like that. Because people have been complying when the police get involved, we don't see that as a necessary tool. If we start to run into problems later on, we may revisit this question.
Thank you, Mayor.
Other questions?
I had a question. I don't know, can you hear me?
Yep.
Just about one of the individuals, I guess, that now has the virus was in a detox facility. Was that an outpatient kind of thing? I think that's what.
That was an outpatient treatment facility. Yes, the person.
Okay, and you're tracking people that might have been there at the same time, I guess.
Absolutely, we do a full contact interview.
Okay, just have one question too. There will be a lot of meetings coming up this week, and now some people are getting the hang of this. I'm glad I got the hang of this today on Zoom. Will these, I think the FOI directives from the governor basically said that these documents that are attached to these meetings, there's a huge agenda for the city plan, should be put up on the city's website. So I'm just wondering if that's going to happen. It's 24 hours ahead of time you have to do that.
We will take care of what we're legally required to do.
Thanks.
Other questions?
Mr. Mayor,
Go for it. Who's
Mayor?
talking?
this is Michael Bingham from New Haven Biz. On the economic front, do you have any updated data on unemployment claims? I don't know if DOL even sorts those by municipality, but do you have any information, either employees or employers?
I do not. I think that's done at the state level.
Okay. Thank you.
You're welcome.
Any chance I could ask just one thought?
No.
Okay.
Go for it, Paul.
A week from today, what are we going to be talking about? What's New Haven going to look like when this thing peaks? Do you have any sense of that? What kind of models are you coming up with?
I think about that every day, and I think about that in the context of our friends and family members getting sick with this, people that we know in our community dying. I think about our staff's stamina because we've been going full speed ahead for more than a week now, and we need to continue on this pace for a month, 2 months. I think that every day we realize more and more the severity of the situation. A few days ago, I was talking a lot about Italy, South Korea. Now we're starting to talk about New York City and look at what's going on with hospitals becoming overrun in New York City, with doctors that use the same N95 mask for an entire week because there's not enough supplies. I'm terrified to think about what we're going to look like in 7 days. And I think it's, there's this balance between not wanting the public to panic, and we don't want the public to panic. We've got to be working on this together. We've got to have people follow the rules, follow our guidance, and support each other, but also people understanding the severity of this situation. And I tend to lean towards always being as honest as possible with my assessment of where I think we're going. And I think it's not a good place.
Good luck. I hope we all pull together and get through it the best we can.
Me too.
We all do.
Mayor?
Another question? Chief, go ahead.
So obviously, I just wanted to make a comment on behalf of the police department. Really, everyone, every city worker, but certainly public safety. I would be remiss if I just didn't point out how proud I am of the men and women in blue. These are unprecedented times. Our people have responded and answered the call. They're coming to work, obviously putting themselves in harm's way like they always do. But particularly now, this, as the mayor said, has an impact on our families, right? And so we have concerns about ourselves getting exposed and then bringing them back home. So officers are dealing with that every single day. So are all of our first responders, and I think it's worth noting how well they've responded to this. And we don't know what the days or the weeks or the months ahead, lie, but what lies ahead, I should say. But one thing's for sure is that because of the team of people that work for us and work for the city, I'm very proud of the work we've been doing thus far, and I just wanted to make note of that, of our officers.
Thanks, Chief. Go ahead, Mary. You have another question? Can't unmute you for some reason. There you go. Up.
How's that?
That works.
There you go.
Okay. Yale has set up, I guess it's taken up one of the gyms in the event that its own population, people using the Yale health plan, I guess, get sick, they can use that if they don't have to be hospitalized, I guess. Is there any facility that the city has identified now, or Yale, in the event that they have so many patients that they need another place to actually send people?
I think that the phases that we are going through with this virus, were first starting to realize just how grave the problem was. Second, really pushing social distancing. And we're not at the end of the social distancing phase, but we're starting to turn our attention to very aggressively preparing for the number of cases that we will have. And one of the components that I feel that we need to do much work on, and know that the hospital is thinking and working very hard on this, is how to address what we anticipate will be pretty bad scenarios with an overrun of our healthcare system, as we've seen in many other places. We're having internal conversations about the likelihood of needing other facilities to help support the healthcare system. And while I don't have, for this press conference, a very solid plan to share with people, we're considering a lot of different options to help alleviate some of the pressure on the system. And I know that the hospital as well is working to do that by making more rooms available, by not taking elective surgeries now, by letting people go that are healthy enough to leave, but maybe previously they would have kept for another couple days. And we're working on potentially identifying more sites in the city where we may need to support people that are suffering from the virus.
Facility that was set up at Yale, or is now, I guess, waiting. Do you know specifically what is it for? Is it people that are sick and need to be some medical care? But I don't know exactly what is functioning. Is it an overflow from the Yale health plan?
So my understanding is that it is a facility that will be used for individuals that have COVID-19, but are healthy enough where they do not need to be hospitalized. And that can be done in a group facility, because since everyone already has COVID-19, they can't transmit it to each other because they've already got it.
So maybe it's students that haven't gone home. I mean, foreign students and haven't been able to leave.
So there's a lot of Yale faculty and Yale employees and students. And again, my understanding is that that facility may be available for those individuals.
Thanks.
Yep. Might be a question to make sure that you reach out to Yale to get more information on.
Right, thank you.
Other questions? Shannon from WTNH.
Hi, Mayor. I know we spoke briefly on Thursday about the Career Regional High School as a site for the homeless. I know that there's a Board of Education meeting supposedly set for tomorrow. Is that still on? And is the controversy or the disagreement going to be discussed at all tomorrow at any length?
So the meeting is still on, and I understand that Dr. Tracy, as a part of her regular updates to the Board of Education, will include information about Career High School and the plans there.
Gotcha. But there hasn't been any other form, like any further conversation as far as the use of it or any other spaces that may be used for the homeless or just anyone that may have it, and what the need of, having an extra place with the overflow being so great.
So in particular on that site, there have not been major changes. I sent out a robocall to the Hill neighborhood last night to notify people and make sure that people understood the reasoning behind the decision, and also to make sure that people understood that the facility would have full-time care, would have public safety officers there, and would increase the safety for everyone in the city, including the Hill neighborhood. We also this morning removed the banners that were in the gym at a request of some residents, and otherwise there's no other major changes.
Thank you, Mayor.
You're welcome.
Mayor,
Yep, go ahead, Chief.
just want to give you an update. Just heard from my people on the ground that the individual that we were looking for is in custody.
This is the individual that left the hospital?
Yes, sir.
Okay, that's great news. Congrats, Chief.
Thank you.
Any other questions? Other questions?
Sorry, you're just bringing back to the hospital, I guess. Is that right?
Yes.
Thanks.
You're welcome.
Other questions? Okay, thanks everyone. We'll probably see you tomorrow.